Nearly 1 out of every 3 adults in Houston and surrounding areas have no health insurance. Hardworking people like you with jobs, families, and dreams who every day have to decide whether to buy groceries or medicine. Imagine yourself forced to make this decision. Imagine your child having a hard time breathing, but you couldn't afford a diagnosis or treatment. Where would you turn if you were in this situation?
601, clear for a call. 1335 West Main, in reference to 3 abandoned juveniles at that location.
Scared and huddled together, 3 children are alone and abandoned by their mother, with only a scribbled note with their uncle's phone number. Hours pass, and Child Protective Services arrives to aid the deserted, frightened children. The mother has disappeared, and the father is in prison. CPS contacts the children's uncle and finds that he is unemployed and unable to provide the sick children with the immediate medical care that they need. The 15-month-old has an ear infection and severe allergies, and the acute asthmatic 8-year-old has been left without an inhaler or any emergency medication. Imagine. TOMAGWA HealthCare Ministries is a non-profit, minimal-fee medical clinic that provides quality healthcare services to low-income, uninsured individuals and families who don't qualify for Medicaid or Medicare. Since 1989, we have offered the comfort of dignified care in a loving Christian environment to an expansive service region. TOMAGWA provides early intervention for potentially fatal conditions and quality health care for chronic illness. As a preventive clinic, we also offer wellness exams, immunizations, vision screening, and a wide range of general care. TOMAGWA HealthCare Ministries continues to respond to the need of our community by providing hope through dignified healthcare and education programs. We serve all people, regardless of religion, race, gender, or ability to pay. We are blessed to be a living example of Christian faith.
At TOMAGWA, we think it's important to treat the whole person, physically, mentally, emotionally, and spiritually. And we consider ourselves a ministry first, and the way that we minister to people is by providing quality medical care, but also quality emotional care and quality spiritual care.
One day we won't be in the financial situation we're in. We will be able to afford insurance, and it will be a sad day for me because they know me so well. I walk in the door and they greet me by name.
There's just no comparison to the way TOMAGWA is to any other doctor. You know, these people care. You know, the Lord has brought them here, and the Lord brought me to them. And I thank Him every day.
I just think a lot of people need teaching and encouragement and hope.
With only a small core staff, TOMAGWA is fortunate to have a faithful and attentive network of volunteer medical and community partners. We are local physicians and family practitioners. We are registered nurses and auxiliary professionals. We are community members, passionate volunteers working together for the health of the community.
This is an excellent way actually to practice medicine without attachment of the insurance, the paperwork, the headache, and just be with the patient and help the patient. We can serve patients in a completely holistic fashion, meaning not only the health, emotionally, spiritually, that is not seen anywhere else. It's really an experience for all of us, all of patients and doctors and nurses and everybody. I mean, pharmacists, everybody. It's really a family here.
What we see here is family practice, But here you get to take care of the whole person, sometimes the whole family, with one visit. Dignity is restored to our patients when they come here because we treat them with dignity to begin with.
The people who are coming in recognize that they're being treated respectfully and not in a way that's degrading. And so there's a special relationship, I think, with the patients that are coming in and the people that are working here, that there's sort of a mutual respect between them, and I really value that.
There's so many people out here that need a little help. They don't need handouts, they just need a little bit of help, knowing that there's help behind these doors.
Tomagwa HealthCare Ministries relies almost entirely on the generous financial and in-kind support from people like you. Since we receive no government or United Way funding, our donor partners are truly at the heart of the healthcare that we provide. Tomagwa is dedicated to the highest stewardship standards, directing most of its funding to patient care programs that benefit children, families, and our community.
I have chosen to be a donor at Tomagwa first and foremost because it's here locally, and we have a lot of people that need help right here in our community. The other reason is it's in my heart to be able to help people, but I know that my resources alone cannot help people, but my resources coupled with other resources from other donors, and then it's being managed by an organization like Tomagwa that is very ethical. They offer excellence in care. My funds can do more.
I have a heart for Tomagwa because it left a legacy for my son, Ryan, to help people every day have a better life.
With nowhere else to turn, these children were delicately treated and cared for by Tomagwa's loving staff and volunteers. Given life-saving antibiotics and other desperately needed medications, Jack, Isabel, and Cade left Tomagwa together, feeling safe in the care of their uncle. As you heard the stories of struggle and care, we hope you are inspired to share your energy, ideas, skills, financial support, time and prayers in the days and years ahead with Tomagwa HealthCare Ministries. Please consider partnering alongside other community members and imagine being involved in a life-changing clinic that provides security and well-being to all people.